So our study sought to understand if there are issues or barriers to calling 911 during emergencies of suspected accidental overdoses in the Waterloo, Wellington, Lynn area. We administered a survey to clientele of methadone clinics in Kitchener, Cambridge, and Guelph between April and March 2012. We also administered the survey through the support and efforts of outreach workers and the Waterloo Region public health staff. There are certainly limitations to our research. First, we use a convenient sample, which may limit how our results can be generalized. And secondly, we needed to revise our survey at the beginning of our administration. And because of this, we weren't able to survey as many people as we would have liked. We needed to make these revisions because we saw that participants were giving socially desirable responses. So if I could just take a moment to explain this. When we first administered our original survey, 44% indicated that 911 was called at the most recent overdose, while 51% indicated 911 was not called, and 5% said that they didn't know. Among the participants who said 911 wasn't called or that they didn't know, 73% said that they would call if they were to witness an overdose in the future. We know that previous behavior is one of the best predictors of future behavior, so it seemed unlikely that so many respondents who had not called 911 in the past would call in the future. We decided that it was a fault of the wording in the survey, and with ethics approval we changed it just slightly. We had 450 people complete our survey in total. 159 of these participants completed the original survey, and 291 did the revised one. 339 people were asked to complete the survey while they waited in a methadone clinic, and 111 were accessed through the outreach workers and the public health staff. So for the next few slides, I'm going to bring you through our response rates and demographic info of participants. We want to give you as detailed information as possible, but for clarity's sake, I'm just going to focus on the results from the new survey. So the response rates were collected at the methadone clinics, and we were certainly pleased with the results. If I can bring your attention just to the bottom of the table where it says new survey total, 75.6% of people who were approached completed the survey, and the response rate was higher for women than for men. The revised survey result can be seen in the third column here. So 40% of our participants were between the ages of 16 and 29, 38% were between 30 and 45, and 22% were over the age of 46. In terms of gender, 62% of our participants were male, while 38% were female. For city of residence, 38% came from Guelph, 35% from Cambridge, 18% from Kitchener, and 4% from Waterloo. So this table looks at general demographic information that is particularly important for this study, such as substance usage, risk characteristics, and overdoses witnessed. 25% of participants who completed the revised survey were on probation or parole, and 39% had children under the age of 17. 64% had used illicit substances in the past year, and 60% used prescription medication for recreational purposes. 72% used at least illicit substances or prescription medication for recreational purposes. And these numbers indicate that we reached our target population because, as I mentioned, people who use substance illicitly are actually more likely to witness an overdose. And for the last three percentages in the third column, you can see that the majority of our participants had experience with overdoses. 59% had witnessed at least one overdose, of which 68% witnessed between 1 and 3, and 32% witnessed more than 3. Among the same group of participants who had witnessed an overdose, 49% said that the last time they witnessed, someone called 911. This means that in slightly more than half of the cases, 911 was not called, or the respondent did not know if the call was made. So I'm going to pass it over to Anthony Piscitelli now, who will describe the details of our results.
Thank you, Kayla. So to begin, I want to come back and take a brief look at the original survey. Kayla did a good job of outlining the methodological reasons and the reasons practically wise that we switched to a revised survey. But I want to talk a little bit about some of the issues that we faced if we had actually stuck to the original survey. As Kayla mentioned, 40% of people who participated in the original survey said that 911 was called the last time they witnessed an overdose. Unfortunately, in that survey, 88% said that they would probably call 911 in the future, and only 11% say that they would probably not call 911 in the future. This was a really important result to us as we were using this question as a filter. Amongst those people that said probably not, we then asked them another question to ascertain why they didn't call 911. Unfortunately, with this sample of 159 people, at this point we'd only had 17 responses actually answer that question, which was the question that we were most interested in, looking at why they didn't call or would not call 911 in future. In addition, we had 6 people who said they would probably but answered, and 3 who skipped the first question but answered as well. So we ended up with a total of only 26 respondents answering that question, which wasn't enough to do anything useful with. Even after we added, we would still be concerned about the total response rate. So for this reason, we revised the survey, and when we revised it, we added a new question, and this new question encompassed the original probably, probably not question and the option questions. And what we asked was, if you were to witness an overdose in the future, do you think you will call 911 originally? Is what we asked. In the new one, we said, if you were to witness an accidental overdose in the future, would any of the following keep you from calling 911? And then within that list, we had a number of options, and one of those options was, I would call, but I would make sure I wasn't with the person when help arrived. And then another option was, nothing would concern me, I would call and wait until help arrived. So we felt this allowed us to get that same information that we were trying to get at, but it also encouraged people to answer these questions and to list the reasons why they wouldn't call 911. Well, with the revised survey, we were quite pleased with the results. We had 2/3 of respondents indicate that they would call 911 in future if they witnessed an overdose. This is a fairly significant drop from the nearly 90% that had said they would call in the previous one. When we looked at these a little bit deeper, the top reason why people said they wouldn't call and their top concern was getting arrested. Now, so when we unpacked the results a little bit, we saw that 54% of respondents indicated that they would call 911 and wait for help to arrive. So this left 46% of respondents who would call 911 and leave, or who would not call 911 in future. So we had a total of 112 respondents who answered the questions as to why they wouldn't call 911, and we were able to look into this in a little bit more detail. The number one answer, as I said, was fear of getting arrested. We combined this one and looked at concerns with probation and parole, and we saw that 58% said that the criminal justice system in some way was a barrier to calling 911. Amongst those individuals who were on probation and parole, 53% indicated that they were concerned about breaching the conditions of their probation or parole. The next answer that really jumped out was 24% said losing custody of their children was a barrier. However, when we focused this one in a little bit more, we saw that 73% of women with children indicated this was a concern of theirs. We have to be a little cautious with this one, as we only had 15 respondents who were women with children. However, that high percentage is something that's a significant concern and likely a significant barrier to calling 911 in an overdose emergency. 24% of respondents said they feared negatively affecting the relationship with their employer, and this was seen as a barrier. But again, when we looked at only individuals who indicated that they were employed, this percentage jumped to 38%. 22% cited fear that their friends, family, or friends would find out as a barrier, and 21% indicated that access to a phone was a barrier to calling 911. So I've given you a little bit more detailed table here to look at the responses. In the first column, I've included all the respondents and what they said. In the second column, I've excluded those individuals who said they would call 911 and wait for help to arrive, and only included the other respondents. There's a few that I didn't get a chance to cover in the last slide, and I'll just touch on them briefly. You can see that 23% of respondents feared having their drugs confiscated. 22% cited the cost of an ambulance as a barrier. 19% feared negatively impacting the relationship with their landlord. 14% indicated a dislike of paramedics or hospital personnel. 11% felt that they themselves could take care of it. This one is actually a significant concern, and we're pleased that it is down on the list, but the literature does talk about some of the home remedies and mechanisms that individuals use to try and address an overdose. And in some instances, individuals do know how to help, but oftentimes they don't, and the interventions they try to apply can make things worse. 7% indicated they didn't believe 911 would help, and 5% indicated that they have naloxone, and this was a reason that they wouldn't call, because they could use that to administer. This is an interesting one because currently, at the time of our study, naloxone and still is not readily available. We were fortunate to get a little bit of insight, and it seems some individuals had done training in Toronto and had taken some naloxone back with them from that training.